Hello. I do not have a PowerPoint this week. I'm going off some notes, which I will take photos of and upload when I upload this video link. If you want to follow along, it will be there for you to look at. So the screening case that we're going over is a 60-year-old female who has osteoporosis, stage 1 hypertension, and type 2 diabetes. The first things first, would be an informed consent. This covers the legal and ethical considerations to begin working with a client, especially somebody new. It's to be taken before any personal or confidential information is gathered from the client. This informed consent is also taken prior to any type of fitness testing, which may or may not be required or even recommended in some cases, but also this informed consent is definitely necessary prior to any exercise participation. And this includes the purpose and explanation of the exercise program, the risks, the benefits, any inquiries, any questions that are, from the client to the practitioner or personal trainer or whoever is, it's an open conversation throughout the whole course of this exercise program. The use of medical records, that it is all confidential and there is that bond between client and practitioner. And then freedom of consent. In this form, it must indicate that the participant is able and free will to remove themselves from this program at any time. One thing that the book was talking about, and a little sample, was like an incident form, which I never really thought about, but I really appreciate, because those things are tangible things for us to put in a client's file, and then just good to have, to jot down, hey, this is what happened, this is when it happened, this is what we did because of that, and this is how that whole situation was rectified. I just think that's like a really good thing to have on hand when we're working with people. So second thing second, the pre-participation is designed to identify people with cardiovascular disease and also like renal disease and metabolic diseases. So anything that's going to be a higher risk of injury or of like a heart attack. We want to make sure that we're aware of these and that the patient or client is in direct communication with their doctor, that we need to have this all kind of laid out before any exercise is participated in, so we know where the client is, where they're headed, their goals, and if a doctor needs to be involved with the medical clearance, or if there's like a better exercise program with more medical supervision that might be better suited for this client with a cardiovascular disease or renal diseases, what have you. So that's what this whole pre-participation health screening is about, and I'm very grateful we're going over this right now, because it is such a practical thing that I think sometimes gets looked over. Like, obviously this is the first thing that you do with anybody you meet, anybody you work with, but some of our classes are more geared to, okay, like this is the anatomy and this is how you exercise and this is what's good for exercise, and it's like this is also really necessary to the overall health of the patient, the client, the person that we're working with, and also benefits the longevity of the exercise program and just the health and well-being of that client-patient relationship. So we're looking for like the current level of exercise, any presence of signs or symptoms of known or unknown cardiovascular disease, metabolic or renal disease, And then obviously, what's the goal of the client? What is their anticipated exercise intensity that they want to work at? So in this scenario that we've been given, my first question would be if she exercises regularly. If she's already exercising 3 days a week, 30 minutes each day for the last 3 months, that's great. If she's not, that's okay. Step 2, are there any known cardiovascular, renal, or metabolic diseases? She has hypertension, but it's only level 1, so it's not a cardiovascular disease, it's just a risk factor. Osteoporosis has to do with bones, so there is risk for injuring them more easily than other clients who may not have osteoporosis. However, exercise would be a good tool to strengthen the muscles and the bones for osteoporosis, so not necessarily a cardiovascular, metabolic, or renal disease. However, type 2 diabetes is considered a metabolic disease. So, step 2, yes, she has a metabolic disease. Any signs, symptoms of CV, metabolic, or renal? So this is where I would be asking her, does she have any chest pain? Any dizziness, any edemas, any known heart murmurs, or shortness of breath or fatigue from doing usual activities among also like exercise. Depending on her answers to those questions, I would move along the algorithm. And then step 4, the desired exercise intensity would be a conversation, whether it would be light to moderate or vigorous. So there's 2 threads, I guess, in my mind. If she was exercising regularly, I do not think that there would need to be a medical clearance before exercising light to moderate for the first, 6 months to 12 months of us exercising together. And then if the client wanted to progress to a more vigorous routine, I think with metabolic disease, I would have her get medical clearance from her doctor. If she has not been exercising for 3 months, 3 days a week, 30 minutes a day, before she comes to me, with the type 2 diabetes, I would want to get medical clearance before starting any sort of exercise, just to make sure with her doctor that she's capable and able. And then at that point, we would start with light to moderate. Either way, we would start with light to moderate. And then I think as we go up in intensity and duration, we would request medical clearance. So that's my screening decision. Simply put, yes, if she's been exercising on her own, I would accept her as a client with the known factors. And if she had not been exercising, I would want medical clearance before exercising with her, and that would be no problem. Anyways, this is 8 minutes long, so thank you so much for listening. I'll put this in the discussion board. Bye.